is a stroke? A stroke occurs when a blood vessel bringing blood and oxygen to the brain gets blocked or ruptures. Deprived of oxygen, brain cells begin to die within minutes. There are two types of strokes. A rupture is when a blood vessel tears and leaks blood into the brain, and a blockage is when a clot forms that blocks the flow of blood in the brain. Last year, many of the 795,000 Americans who suffered a stroke did not get the right life-saving treatment in time. So what are some risk factors that may make a person at risk for having a stroke? High blood pressure, cigarette smoking, diabetes, and eating a poor diet. Act fast. Fast is an easy way to remember and identify the most common symptoms of a stroke. Recognition of a stroke and calling 911 will determine how quickly someone will receive treatment and help. Getting to a hospital rapidly will more likely lead to a better recovery. Use FAST to remember the warning signs of a stroke. F is for face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the person's smile uneven? A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S is for speech difficulty. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? T is for time to call 911. If someone shows any of these symptoms, even if the symptoms go away, call 911 and get to a hospital immediately. Other symptoms you should know may include sudden numbness or weakness of the legs, sudden onset of confusion, trouble seeing in one or both eyes, and lastly, loss of coordination or balance.
Now for some review questions. Remember, FAST is an acronym you can use to spot the warning signs and symptoms of a stroke. Let's take a minute to remember what each letter stands for. First, let's start with F. What sign does F stand for? F is for face drooping. Next is A. What does A stand for? A is for arm weakness. Then we have S. What does S stand for? S is for speech difficulty. Last but not least, we have T. What does T stand for? T is for time to call 911 if you experience any of the symptoms above. What are some risk factors that may cause a stroke? A. Smoking. B. Poor diet. C. High blood pressure. Or D. All of the above. The answer is D. All of the above. Sudden numbness or weakness of the legs may be a symptom of a stroke. True or false? The answer is true.